Hi guys, and thanks for joining me. My name is Heather Conley. I'm a functional medicine practitioner, and I wanted to come to you today with some Q&A and some information on the difference between Western medicine and functional medicine. So if you're listening live, if you could let me know if I'm coming across clear with some hearts or some thumbs up, that would be appreciated. And I'm going to tell you a little bit about what we're going to do today too in terms of a raffle. So if you could give me some hearts, some thumbs up, and let me know that I'm coming in A-OK. And if you also want to put below where you're from, where you're listening in from, that would be fantastic. So again, my name is Heather Conley. I'm a functional medicine practitioner working remotely in New Mexico. And so what I wanted to do with this video today is, if you're listening live or if you're listening to the recording, if you could tag in the comments below 5 people that you think would benefit from listening to this video, and anybody that tags 5 people, so I'll be going through and counting. You can tag 5 people in the same post, you could, or in the same comment, you could tag people in 5 different comments, it doesn't matter. The cutoff would be 7 p.m. Eastern time tomorrow. So if you're listening after that, that's cool. I still would encourage you to share it with anybody that would benefit from listening. But the cutoff for the raffle is 7 p.m. Eastern time tomorrow. So at 7 p.m. Eastern, or at or around 7 p.m. Eastern tomorrow, what I'll do is I'll have my fiance pick names, so it's a neutral person. I'll put all the names in a hat, anybody that tagged 5 people, and the winner of the raffle will be will get $100 off a consult with me. So I'll reach out to said person, I'll tag you to let you know that you won, and then I'll reach out to you via personal message to set up an appointment to get the ball rolling in regards to the consult. So the rules again: tag 5 people that you think would benefit from listening to this video in the comments below. Again, it has to be 5 people, and feel free to share it on your Facebook wall too. That would be awesome, but you don't have to do that to be entered into the raffle. You just have to tag 5 people, and if you tag 5 people in the same comment or in multiple comments, I will put your name into a little hat, and you'll be entered into a raffle to receive $100 off a consult with me. So what I wanted to come to you today with is a little Q&A, so feel free to type any questions in as we go along, as they come to your head, because sometimes we think of a question and then 5 minutes later we forget what the question was, right? So feel free to type it in as you think of it, and I will get to them at some point during the video. If not, when you ask your question sometime during the video, I'll get to that. So I wanted to come to you today with the difference between Western medicine and functional medicine, because I think there's a lot of people that don't know what the difference is, and that's understandable if you've never gone to a functional doctor or a functional practitioner. And I have a couple examples that I wanted to use, real-life examples that I wanted to use to kind of show you what the difference is in the two modalities. So Western medicine, basically, when you go to your regular doctor, what they're looking for is, when they're looking at lab work, they're looking at within the reference range values. So you may have heard, and type in the comments below if you've heard this, after you leave your doctor, or your doctor calls you, or the nurse practitioner calls you, and they say, okay, well, your lab work came back and it's normal. And you still feel like crap. But they told you that it was normal, and you don't know any better because you don't know how to read lab work, so you figure, well, they told me it was normal. So the difference between that and functional medicine is that functional medicine is looking at optimal ranges within that reference range. So the reference range is basically a statistical norm of the general population. And the general population is typically the diseased population. So you don't want to be normal. You want to be optimal, right? So when clients come to me with lab work, which is one of the things we do during a consult, is look at recent lab work, is, they're often surprised to hear me pick out things that, their doctor said all of their lab work was normal. And I'm going through their lab work with them, and I'm picking out things that aren't optimal and could definitely be the cause of a lot of their challenges. So Western medicine looks at the body as pieces and parts. So, your gallbladder is separate from your liver, and all of the different parts are not connected at all. And that's not true. In functional medicine, we look at the body as a whole because everything is connected to everything else. For an example, I was listening to a call the other day with one of my mentors that was from a client that had a wrist infection that originated from his gut. So, if we have gut issues and we have what's called intestinal permeability, you may have heard it called leaky gut. If we have leaky barriers, we can have leaky brains. Bacteria that's in our gut can migrate to other areas that may be suffering, or said gentleman had a wrist injury. So, that area was, was suffering. And so the bacteria that was in his gut traveled to his wrist, and his immune system freaked out because, bacteria in your gut isn't supposed to be in your wrist. So that's a major challenge to the immune system. So just for an example that, your body is just not pieces and parts. It's all connected. It's all interconnected. Hormones are all interconnected. So that was an example I wanted to use in regards to the difference between functional medicine and Western medicine. And going back to who I am, again, my name is Heather Conley. I'm a functional medicine practitioner. I work remotely in New Mexico with people all over the United States and Canada. But basically what I do with my clients is I work with helping them get to the root causes. And that's the main thing that functional medicine does for people is whereas Western medicine is more of a Band-Aid approach where we treat the symptoms and then we're not really getting to the root cause. And Western medicine practitioners aren't trained to do that. That's not what they went to school for. That's not what they're trained to do. So I'm not bashing them. That's what they're trained to do is put a Band-Aid on symptoms and hope you feel better. And a lot of you here that may be listening probably have fibromyalgia or were diagnosed with fibromyalgia because that's probably how you found me. A lot of the times, we get to the point where we're told that there's nothing else that they can do for us because they've tried to make us feel better. And in the process of doing that, most of the time, we're actually made to feel worse. Whereas functional medicine is getting to the root cause challenges of why you got sick in the first place. So I deal with people with fibromyalgia. I also, I work with men and women. I work with people that have, that don't have fibromyalgia, that have they don't feel well and they have symptoms of not feeling well and, some challenges there. I work with people that have diabetes, people that have hormone issues. So basically anybody really. Autoimmune is a specialty of mine. So, but the premise behind functional medicine is getting to the root cause of why you got sick in the first place or why you don't feel well. Fibromyalgia is a name for a collection of symptoms, all with a root cause. So if you didn't listen to my last video, I encourage you to go back and listen about, if we go to the doctor, and I had to get on last time because I had to have a bit of a rant, but we go to the doctor with a strange symptom and the doctor tells us it's our fibromyalgia because we've previously been diagnosed with fibromyalgia and somebody doesn't know what to do with us. And so in trying to kind of fix us, they stick it into the fibromyalgia bucket because that's what we were diagnosed with. And that can be really challenging because a lot of the times symptoms that we're having aren't fibromyalgia related at all. And, that could be dangerous for sure. But all fibromyalgia has a root cause. There's a reason why you got sick, and there's many, many root causes to fibromyalgia. There's many root causes to a lot of disease processes. And in order to get well, in order to feel your best, you need to get to those root causes. The medications are simply a Band-Aid to treat symptoms that oftentimes make the root causes worse. And I'll say some examples later, but a lot of the times the medications, especially the SSRIs or the SNRIs, make fibromyalgia worse just because a lot of people that have fibromyalgia don't have enough serotonin as it is. SNRIs and SSRIs fake the brain into thinking you have more serotonin than you do, and the body's pretty smart and it has mechanisms by which it understands that this is happening and it stops making its own serotonin. So the challenge is a lot of the medications that the doctors are giving us, the Western medicine doctors are giving us to put a Band-Aid on it to help us feel better. They have good intentions to help us feel better. That's making the root causes worse. So again, if you have any questions about your unique situation or anything that I'm saying, please don't be afraid to ask questions. For some strange reason, I can't see anything on my screen. So if I'm not seeing your question and I see it after, I will answer questions after. And if you're listening to this as a recording, please don't hesitate to ask questions or make comments. I will be responding later on today to any comments that were made. So please don't hesitate to do that. So I wanted to use a few examples of the difference between Western medicine and functional medicine in my own client cases so that you can kind of get an understanding of what I do and the difference between the two modalities. So I had a client, and of course no names will be mentioned. I had a client come to me a few months ago, not diagnosed with fibromyalgia or anything like that, but suffered from a lot of various different symptoms, headaches being, pretty chronic headaches every single day, but just not feeling well at all. And, post-consult, what I usually do for people is give them a list of lab work that I think would be beneficial to have run on top of what they've already given me, or sometimes people come to me with no lab work. So I had given her a list of lab work, and, in the interim, we worked together to kind of triage some of the symptoms that she was going through. And lab work came back, I think it was last week or the week before, and, a few of her vitamin and mineral levels weren't even in the reference range. So when a Western medicine doctor tells you, oh my God, you aren't even in the reference range, or your quote unquote is your vitamin D levels per se are low or suboptimal, or I don't think they even use the word suboptimal, or out of the reference range, that it's low, because typically Western medicine doctors, if you're within the reference range, they usually say, okay, you're cool, you're within the reference range. And again, I'm looking at optimal values, but her levels weren't even in the reference range for three major things that are making her feel like crap. And what I wanted to describe this to you is because this poor woman had been going to her doctor for years, telling them that she did not feel good. And to no avail. Nobody could figure out what was wrong with her. Now, some of the things that we found out through this particular lab work is kind of what I call peeling back the layer of someone's onion, because, we got to where we are by a series of events. So as we kind of peel the layer of the onion back, we figure out, we may find things that we didn't know were there. But just on the surface, these lab markers were shocking, really, really shocking to me, because like I said, she had been going to the doctor for years trying to tell them that she did not feel well. And some of these things that I had told her to go get, because, I thought that these could be part of the challenge, came back not even within the reference range. To be honest with you, I'm not even sure how she's walking around and functioning, because they were really shockingly low, for sure. Another example I wanted to give you was from a client that has some pretty severe autoimmune issues. He had come to me a couple of months ago. We recently just started working together. I think we've only had a couple of sessions. And like I said, he's got some pretty severe autoimmune challenges. So, lots of work to do together for sure. And again, we just started working together, but his situation's pretty severe. And a couple of weekends ago, he had ended up having to go to the emergency room for some things. And long story short, he had gone back to his rheumatologist and was basically told that a certain medication on top of the medications that they had already put him on was the only thing left in Western medicine that could possibly help him. That to me is very sad. And it's like the Western medicine community is actually admitting now that this is all we can do for you. We have we have limitations for sure, and this is, you get to this certain point and we cannot help you. And if you are the patient and say, so I was thinking about this, and it really, it just shocked me and just made me mad, really. And I actually had a Facebook rant about it and I think, I did it on my personal page and on this page, so you probably would have seen it. But to me, that's if you're the patient and you A, don't know any other way. Hi, Amber, how are you? The only thing I've seen so far. So I don't know if anybody's commenting, but I'm just going to continue talking. But the challenge to me is, and it saddened me, is that, if this poor person, goes to their doctor and they're told, this is all we can do for you. This is your last resort. This procedure or this medication right here is it. If you're the patient and you don't know anything about functional medicine, you've never heard about functional medicine, or this person had not already been starting to work with me, how does that make you feel? You're suffering greatly, and you go to the doctor and you're told, this is all we can do for you. If this doesn't work, that's it. And you're in your mid-30s. How does that make you feel? That makes you feel like you have no hope, that you're never going to get better, and if this doesn't work, now what? Luckily, this person has been working with me and knows that, there's other options, and we had chatted back and forth about, what they had said and kind of where to go from there. But that to me is like, kind of like when people have fibromyalgia or something similar and they go to the doctor and, this is all we can do for you. I've heard that so many times from so many clients that that's what they're told. And a lot of the times my clients that's when they get to me. That's how they find me. Somehow they find me, or they find somebody else in the functional medicine community, because oftentimes when people get to me, they've lost all hope, or they feel like, I'm their last resort, because if I don't work, then their Western medicine doctor already told them that there's nothing else they can do for them. And and like I said, it just saddens me, because then you've lost all hope of it ever getting better. And it doesn't really matter what age you are, but if you feel, really crappy, and if you felt really crappy for some odd years, and this is what you're being told is, this is it, that's sad to me. So that was another example I wanted to use between Western medicine and functional medicine, because basically what they're telling this gentleman is that this is the last Band-Aid that we can put on it. Other than that, we don't know what else to do with you. And by getting to, in functional medicine, by getting to the root causes, that's going to help somebody get well. And there's all kinds of things we can do, especially if you have a ton of root causes going on, then we could work together for years and still kind of be scratching at the surface. So that was another example I wanted to use. And then the third example I wanted to use was in reference to lab markers. So I had somebody tell me the other day that they had gone to their doctor and their vitamin D level was 29 or a 30, and that was okay. That's not okay. That's you're at 29, you're not on the reference range. At 30, you're just on the reference range, and that's not okay. And that's a Western medicine doctor telling somebody that because they live in the Northeast, this said person lived in the Northeast, because they lived in the Northeast, that 30 was okay, and it's not. and it's shocking to me that that's being told to people, that just you're on the reference range, so you're a-okay. A vitamin D level of 30 is not okay, and the reason why is we need sufficient vitamin D for optimal immune function. If we don't have optimal immune function, we set ourselves up for autoimmune disease. If our immune system is freaking out on a daily basis, that is the gateway for autoimmune disease. A lack of vitamin D also sets us up for intestinal permeability, which also sets us up for autoimmune disease. So yeah, a vitamin D of 30 is not okay. And there's a reason. If somebody is taking vitamin D and they cannot raise their vitamin D levels, then there's a reason why. There's often root causes as to why we can't do that. Sometimes it's as simple as not enough. Sometimes it's as simple as not enough magnesium, and sometimes it's gut issues, or methylation issues, or methylation SNPs. You may have heard of MTHFR, things like that, can cause malabsorption of vitamin D. Things in the gut can cause malabsorption of vitamin D. So I wanted to use those three examples for you today, so you could understand the difference between functional medicine and what I do in regards to helping people and get to root causes, versus Western medicine that is slapping a Band-Aid on it. And that's why a lot of people, when they come to me, are very frustrated. And I find a lot of times have lost hope of ever getting better. And I think I made a video a couple of weeks ago entitled Hope. So if you haven't seen that yet, I would encourage you to go back and listen to it rather than try to find it on this page. It might be easier to go to my website, which is fitwithfibro.com. And there's a section there with all of the videos that I've made. So I would encourage you to go back and listen to that, because I made a video just about hope, and that there is hope of getting better. If your Western medicine doctor has told you that there's not, then I would encourage you to find other resources. If it's not me, somebody else, please, because you're not destined to feel badly for the rest of your life. There are options to getting better, for sure. And the limitation really is just you wanting to get better. So I think if you really want to get well, then you'll find ways to do it. I have a lot of clients that quote unquote may not have been able to afford me, but have found ways to do it because their priority was them getting well. So I find sometimes that the only limitation is really yourself. So in wanting to get well, and if you do want to get well, you'll find a way, or you'll research or whatever. So I just wanted to come to you today with that. And if you have any questions, if you're listening to this recording, please don't hesitate to ask questions. As I stated at the beginning of this video, if you tag 5 people, so tag in the comments below, if you tag 5 people today or tomorrow, the cutoff is 7 p.m. Eastern. So I am 2 hours behind, so that's 5 p.m. my time. Sometimes I have hard time doing higher math. So that's 5 p.m. my time. So at around that time, I will, maybe a little bit after, I will have all of the names in a hat, and my fiance will pick one, and I'll record it so that you guys can see that we actually did it the right way. And I'll post that recording for you. I'll also tag the person that was the winner, and that particular person I will be in touch with via personal message to let them know that they won, and we can get the ball rolling in regards to setting up a consult. So the raffle is for $100 off a consult. And again, it has to be 5 people, so I'm going to go and count. The easiest way to do it would be to tag 5 people in the same comment, but if you want to tag 5 people in separate comments, that's fine too. I'll just go through and count. I can do that. So if you do tag 5 people, you'll be entered into the raffle to win the $100 off the consult. If you also want to share this video on your wall, that's not required for the raffle, but if you wanted to do that, that would be awesome. I appreciate your support, and you may reach someone that this might resonate with. Feel free to tag, not only 5 people that have fibromyalgia, but people that have autoimmune challenges, that have diabetes, that have allergies, asthma, hormone issues, anything really, because all of those people that I work with, men, women of all ages. So if you have an aunt, an uncle, or a mother or a friend that has something that you think they're not getting better and they might benefit from maybe looking at what functional medicine can do for them, feel free to go ahead and tag those people. I'm sure that they would appreciate it. And then you get entered into a raffle. Yay! So I'll pick those names. 7 p.m. Eastern tomorrow is the cutoff. If after this, after the cutoff, you want to tag 5 people, please don't hesitate to do that. Just because it's 7 p.m. doesn't mean you can't tag people. We can always help people, right? It's the power of a lot of people kind of helping one another. So if you have any questions later, please feel free to post those comments below, questions, comments. If you feel like you want to reach out personally, if it's something that you don't want to post publicly, I totally understand that. Feel free to reach out to me. There's a little message thing up at the top of this page that will give you the option to reach out to me personally. If you can't find that little message thing, sometimes it eludes people. My email is clientcare@fitwithfibro.com. So if you prefer email, you can reach out that way. And again, you can comment here. I'll be available later to answer questions after this video is over. And my website again is fitwithfibro.com. So there's a page over there with a bunch of videos that I've done, so don't hesitate to go over there and check them out. And there's also a page on the website fitwithfibro.com that has a bunch of testimonials from clients that I've worked with and that I'm still working with, most of them. So if sometimes people want to see that, it's worked for other people. So that's why I put those testimonials over there so you guys can go check them out. So again, if you have any questions, you want to reach out personally, you want to post here, feel free to go ahead and do that. And the raffle ends tomorrow at 7 p.m. Eastern, and I'll be pulling one name out of the hat to win $100 off a consult. So feel free to go ahead and tag those people now or later, as long as it's before 7 p.m. Eastern tomorrow. So thank you for joining me today, and I will talk with you soon.